Have you guys ever had knee pain so bad that it stops you from playing soccer? Or you can't even shoot the ball properly, or even a simple pass hurts? Well, this happened to me, and this is called Osgood-Schlatter. In this video, I'll be explaining what it is and things to help it, so stay tuned. So for me, it started about a year ago, where I started feeling sharp pain in my left knee. I thought it was nothing, I thought I just got kicked or something, so I kept playing, but it kept on hurting, and then I started feeling it in my right knee. And I kept telling myself and wondering what it was, because every match and every practice, I would always feel it. And the worst part about it is that I had to take so many days off. I had to take a whole month off because of this. And I just felt super anxious, sad, and mad about it, that I didn't know what it was, and it just kept affecting me. After seeing a couple doctors and some physical therapists, I found out that this thing is called Osgood-Schlatter. It affects roughly around 1/10 of athletes going through puberty. It usually happens when you're going through a growth spurt, so basically in between 9 and 15. Technically, it's when your tendon connecting your kneecap is pulling on your shin bone. And so when you're jumping or playing, like when you're playing soccer, it results in pulling way more, and that's what causes the sharp pain. And since your body is still growing, that area starts to get irritated and it starts to get way more painful, and it often results into a bump. So yeah, it's basically just growing pains from doing sports. The good news is Osgood-Schlatter isn't too bad. It isn't temporary, so it doesn't stay with you forever. Sometimes the bump does end up staying for a long time, but not the pain. The pain usually goes away pretty fast. It doesn't prevent you from doing sports, but you do have to manage the pain that comes with it. And so here's what helped me deal with it and to keep playing. Number one is listening to my body. Some days I'll play well and it won't be that painful, so I'll keep playing on. But then other days it feels worse and it's more painful, so that's when I really have to kind of back off and then rest. Number two is stretching. Stretching really helps me because when the muscles are tight, stretching really helps them relax, and I would definitely recommend it. It's good to do when you wake up and right before bed, and it's also really good to do before practice and after practice. Number three is icing. Icing is especially good after games. It helps calm down the inflammation and calms down the pain. What I found is it's basically an ice pack that you would put in kind of a band thing. And this band, you usually put something here so it doesn't give you frostbite. And you would put it around your knee where it hurts, a bit below the knee. And then you wrap it around just like this, and then you put a timer or something and you wait 15 to 20 minutes. And so that gives it time to cool down, and so the inflammation goes down as well. Number four is physical therapy. Not only did he show me what I had and explained it to me, but he showed me the stretches that I should do and things that I could do at home that could really help it. Number five is sometimes medicine. Medicine can usually help if your pain is really high and doctors tell you to use it. But I wouldn't use it if a doctor didn't say so. Number six are tendon straps. People recommend these because they really push on the tendons and they release a lot of the pain, and they mostly use it during games or during practices. So it's basically almost the same thing as the icing. You put it below your knee, but in front of the bump, so right in between, and then like any other strap, you put it on and then it goes around, and you can adjust the size, and this really helps because during games you're usually pulling on your tendon, and so this helps relax it. And number seven is being patient, because Osgood-Schlatter isn't one of those things that you can just make go away. You just need time because your body just needs to adapt and it just needs to keep growing. If you're going through knee problems just like me, just know that a bunch of other kids are going through it, so you're not alone. And the good news is, it usually goes away as you grow. The key is to take care of your body, to not ignore the pain, and to find what's best for you. Thanks for watching, and if you guys go through any knee problems, tell me what you guys do to make it feel better. And if you guys want to see more videos about soccer, don't forget to subscribe. I'll also be sharing a link about what I learned at the Real Madrid Academy. Thank you guys, and don't forget to like, because this really helps the channel. So I'll see you guys at the next one.